My mum came in on respite care. She's been here 3 years now because she didn't want to go home after. The only difficulty I found was trying to find the right place for mum's needs.
It's usually the families or the carer that comes in and looks for on behalf of the client first. They come into the home and they've only got a piece of paper with all the names of the homes on them. They're told that they've got to choose 3 homes and prioritise 1, 2, 3. Then after that they've got to look around and see which ones they want, and then they go back and give that information to the hospital or community where they are, but they don't know what they're looking for. They don't know the category of care. They don't know what kind of nursing or residential home they're going into, what their client needs or what their family member needs, and they're just absolutely flummoxed with the whole thing. I can honestly say about 80% of the people that come in here looking for a home, when you sit them down and you get to the nitty-gritty, they're in tears because they don't know where to start.
We had a meeting with the relatives at this nursing home, Glanravon, and they were explaining how many issues they had in selecting care homes.
One of the relatives in particular was saying that they had a lot of trouble finding a home for their relative, and wouldn't it be nice if there was sort of something that they could look up on the computer to find out more about the homes. And Tanya said, do you mean something like a TripAdvisor? And they said, yes, that's exactly what we mean. And then when, in the chat service, when we did a pilot study, it not only came up then, but it came up lots of times in other homes as well. This transition, this finding homes for relatives, just seemed to be a real big thing. It wasn't something that we were going to really focus on, because we were focusing more on now the residents were here, but it came up so many times, the difficulty finding homes, that we felt we needed to do something about it.
We were successful with a bid to the Health Technology Challenge Awards and worked very closely with the South East Wales Academic Health Science Partnership to pilot in this area a TripAdvisor type web-based system for care homes. We were put in touch with the Good Care Guide in England, who had already implemented this system across England, met with those. They have adapted the website to suit a local need, and we're launching that website in March. Good Care Guide is already active in Wales. The issue that we've had is that providers didn't really know about it, older people didn't know about it, relatives didn't know about it. This pilot is a real opportunity to actually launch this properly in Wales.
If there is a way wherein patients and the relatives can have an informed, quality information which is available there, they can make those decisions quite quickly. We can understand that it's a very difficult decision for the patients and the relatives, for their loved ones to be going to a care home setting, but this would be an excellent initiative wherein they have quality information and they make their decisions quite soon.
The vast majority of our patients who've sustained a stroke have significant physical disabilities associated with the stroke, as well as cognitive impairment. Unfortunately, a number of our patients will never return back to their own home. A decision is sometimes made with the family, with the patient, and with the medical, nursing and therapy teams that their future care needs will have to be met in a nursing or residential care facility. And so they've suffered what is a significant life event, suffering a stroke, and now they're faced with another life-changing event, which is making a decision regarding a future nursing or residential placement. That's why we welcome the Good Care Guide, and we welcome this pilot, which will enable patients to view comments made by other individuals who've had to make that same choice. And so the guide gives individuals the opportunity to view comments, and then gives them the opportunity to actually make informed choices about their future placement.
Kay was an Alzheimer's sufferer, early onset Alzheimer's, and unfortunately she was diagnosed at 51. We had a few good years together. The medication held things at bay for a while. We were able to enjoy our life as much as we can. I retired from work early. But as a progressive disease, and Kay was gradually going downhill, it eventually got to the point where she wouldn't accept help from any other carers. she was refusing food and drink and medication. So hospitalisation was the only answer. The hospital managed to nurse her back into a better state of health, where eventually the decision was made that Kay's care could be transferred into a care home with nursing. But unfortunately, because of her age, still being very young, most homes sort of set their lower threshold for that sort of care at 65 years, and Kay was still well below this. So there were very few places I could actually find that could accept her. It was very, very stressful. I remembered that Kay wouldn't have given up, and I should do the same. So I just determined I was going to visit as many of the care homes on the list as I could, regardless of whether or not Kay fitted into their profile. And eventually I came here. And talking to the lady who'd shown us around, who confirmed that, although it ticked many of my boxes, because of Kay's age, there wasn't an automatic place available here. But she reassured me that following a visit to the hospital to check that Kay's care needs could be met by the service they deliver here, they could simply ask for a variation order. It's something I never even heard of. I knew nothing at all about it, but she was quite certain that it wouldn't be anything extraordinary for a variation order to be granted, so that Kay could come in regardless of her young age. And to be honest, I didn't know whether to laugh or to cry. It was wonderful. It just appears to me that all I went through was probably, in the largest part, unnecessary. If there had been something like Think About Me care home guide in place at that time, I may have had a busy 10 days, but I needn't have gone through all this heartache.
There's been so much hype about care homes at the moment that people are not having very good care. But there are also places where people have wonderful care, you know, and they're treated like loved ones themselves while they're here, not just by ourselves, but by members of staff. I know my mum is safe and secure here, and I would like that review to go on for other people to know that they can go into that home with the knowledge, knowing that their loved one is well looked after, well taken care of, and is loved by the staff that are here as well as their own families.
I think it's a fantastic idea, and I think it's well overdue. It's going to give us a lot more ability to support patients and relatives through this really difficult time of theirs. So yeah, I'm fully in support of the Good Care Guide.
The benefits to patients and families is that they will be able to see real live feedback in one place on one website. That website will link into other sources of information, for example, inspection reports. I think it's an opportunity for them to actually share with others their experiences of what it's like to live in a nursing home. And for the providers as well, it's an opportunity to respond quickly to any concerns raised, and also the positive feedback, and celebrate what they do well.
If you liken it to something like TripAdvisor, not only do they list the basics, they give so much additional information which could help people to decide whether that's the place for their loved ones or not. I've often said you need silly little bits of information like, are there nice gardens you can wheel your loved ones around and let them smell the roses, and is there a bus stop close if I couldn't get the car, if I wasn't able to drive one day? You know, little snippets of information like this can make all the difference when it comes down to choosing what is meant to be a permanent home. And yeah, anything that could provide those sort of details has to be invaluable, and I'd wholeheartedly be behind it. Yeah.